Thank you very much. As you said, I'm Robert Moon, and I'm glad to kick us off today. We have a set of a set of lead discussants today who will be leading the presentation. I will just be providing a brief introduction to what we're discussing today. Let me first remind everyone this integrated provider system application training is related to the additional funding that comes through the 1115 waiver to the state of Alabama to be able to implement transformative activities in relationship to the Medicaid population and the regional care organizations. So that is the realm that we're working in, and today we will be providing many more details that have been developed that hopefully will help answer a lot of questions that we've received in one way or another. Obviously, our RCO portal has received many questions, and questions specifically relative to IPS have been recorded, and there are many answers out there relative to IPS also already. Today you will get even more information. As a brief reminder, you may have read this elsewhere, but today we'll be doing a presentation. Today is not Q&A. Today will be a presentation to review what we have to cover, and then actually tomorrow will be another webinar which will be focused on Q&A. And we'll have an open floor tomorrow to delve into it however you need to with your specific questions. Both presentations are being recorded and will ultimately be posted to our website, as were previous presentations relative to IPS. Let me provide just a brief update in terms of where we're at with the agency and RCO implementation. We are in a new chapter of the development of the RCOs, in that our legislative session, as many of you know, just recently came to a close. The legislature overrode the governor's veto of the budget that was passed, so that the override passed the same budget again, which provided Medicaid with $700 million in state general fund support. As the commissioner had made clear, we certainly need more funding than that in order to be able to continue to fully move forward and to be able to fully develop the RCOs and to avoid cuts to the program. Well, we didn't get that, so we're exploring right now how to move forward and what types of things we might be able to do. Part of the effect of the $700 million funding is a delay, and the commissioner announced yesterday that there would be a delay in the implementation of the RCOs. We've all been working toward an October 1 of 2016 implementation date. The commissioner announced yesterday that there would be a delay. However, it has not yet been determined exactly how long that delay will be, if it will be 3 months, 6 months, or something else. So she has a meeting with the governor soon to discuss the delay timeline and to get very specific in terms of what the delay actually means in terms of how many months delay there would be. Additionally, as has been discussed previously in public forums, there will be a discussion around specifically which cuts to the program will be necessary to deal with the funding level that we have. Additionally, there will be discussions with the governor and others about how we might be able to identify further funding that might in fact allow us to go forward with the program. So there are several things on the table, and the outcome of those discussions obviously will also be shared with CMS, and we'll have to have their input with what options we have relative to moving forward. We obviously have had ongoing dialogue with CMS, and they're very aware of our budget situation and the impact that it might have, but they are following along very carefully and are very willing to continue to work with us at this point. So there are uncertainties on the table, and we recognize that. However, we felt like it was very important to go ahead and present the information as planned today and tomorrow relative to IPS, because even a short delay would be helpful in some ways, because it would allow you more time to develop your plans and perhaps to be more thoughtful about what actually will be proposed. We have a large number of LOIs that have been submitted to date. and we will be reviewing some of that a little bit later in this presentation. But I have asked the Navigant team that's with us today, that'll be taking over in just a minute, to go ahead and present as though the timelines had not changed, as though we were still working toward the October 1 implementation, realizing that until we know definitively how much later the implementation will be, it's a little hard to modify the timelines right now on the fly. So we do recognize that the dates and times that will be discussed will be shifted. We just don't know how much they'll be shifted by. But I felt like it was important to go ahead and discuss the timelines as though there was an October 1 implementation, so that you would still get a feel of the time frames that would be involved in terms of how one step would lead to the next step in moving us forward. Again, all of this is pending CMS approval, so there will be more discussion with CMS, but we look forward to hearing the presentation today and the questions tomorrow. So with that, I'm going to turn it over now to Tommy Carlisle with Navigant, and then there will be subsequent presenters also. So, Tommy.
Thank you, Dr. Moon. We appreciate the opportunity to spend time with the providers today over their lunch hour. I am joined here with my colleagues Christina Kostner and also Dustin Schmidt. All three of us have been assigned to the Alabama project for over 2.5 years and worked very closely with the state team, Dr. Moon and others, not only developing the IPS, but working with CMS on weekly calls through the negotiations, so we're fairly familiar with it, and I'm sure that we know many of you that have attended the meetings over the past year or so. First up is the agenda, what we're trying to accomplish today. We would like to take you through the process and timeline. As Dr. Moon's already said, that timeline is very likely to move out, and we can still talk about, you know, the space in there and maybe how we'll approach that. We also are, based on the LOIs, we want to do a very high-level summary of what RCOs have submitted on behalf of each of the providers or groups of providers, to kind of take you through that and show you the magnitude of what was requested and kind of give you some context on that. We also have developed, although CMS hasn't officially approved even verbally, a guidance based on what was submitted in the LOIs. Part of that process was for the state to be able to take a look at what was submitted and to refine the guidance that we would be giving to the providers and RCOs to better improve the application process. We're also going to touch a little bit on the provider roles in context with the RCOs and developing the process. We'll take you through a funding example and tell you a little bit about that. And if you got the alert, I think it was on Friday afternoon or Friday night, we'll take you through some of the application materials. Two of the key things that are in those materials is the IPS protocols and the IPS application. If you've had a chance to look at that, you can see that as a fairly robust package. We're going to take you through that, show you where it is if you haven't been able to find it on the website, and kind of take you through quickly, and then maybe orient you just a bit so that maybe overnight you'll have a chance this afternoon or tonight to kind of look at it and develop your questions. We'll also quickly take you through an appeals process, and then we'll go on to the next steps at that point. My colleagues and I, although we've been assigned the last 2.5 years to the Alabama project, we work in a number of other states, and I really want to applaud the agency, the Alabama Medicaid Agency's, transparency in this process. Over the past year, we met weekly with CMS, and the agency has been very quick and transparent to push out information to both the RCOs and the providers to keep you apprised of what is going on in the process, and we don't always see that in other states, but we do applaud that. Basically, the timeline for the IPS, you can see we're a couple of months in that. Many of you may have attended some education on IPS over the past couple of months, and obviously you were all that submitted LOIs participated in that process. We are currently at the early stages of May. We had anticipated approximately a 60-day, which was very tight according to the timeline that CMS had given us, to keep to the STCs that had been approved by our federal partners, that we were forced to have a very, very condensed timeline, and the potential delay that Dr. Moon has talked about will most likely push us out from that July 1 date a minimum of maybe 3 months, maybe further. But you can see that, if we were moving forward with the application process with the due date of July 1, that would give providers and RCOs about 60 days to collaborate. Then it would focus back on the agency to review with an independent review team, with the ultimate decision being made by the agency about 60 days to go through those applications very thoroughly. And then the intent was to award between September and October, to know the awards that would be available for a launch in October. Obviously, again, we mentioned that is actually going to be pushed forward. We'd like to now give you a quick overview of what you and the RCOs have submitted. What you see in this slide is we received 640 LOIs that total slightly more than $1.961 billion. The average application was for about $3 million. And the reality, when you look to the columns to the right, is that the IPS funding pool has available, based on what CMS has approved, $278 roughly $1 million. To give you a little context, and this has changed, and we've received several questions on this, and we'll talk about it a little further during the Q&A tomorrow, is that if you look at the duplication, the footnote number 1, most providers submitted their applications for LOIs to multiple RCOs within a region, which is what the state was encouraging at that time. So you can almost take that 1.6 or round it to 2 billion number that the state received and almost cut it in half to about $1 billion that we received in non-duplicative LOIs for IPS projects. With some of the further guidance, if you flip to the next page, these were the top 10 areas that were submissions for LOIs, and you can see those. I won't read them off to you, but the guidance document that we've submitted to CMS within the last week or 10 days is to be able to refine and give better guidance to RCOs and providers. For instance, and we'll go into this in a little more detail, one of my colleagues, but if you look at number 3 on the list, care coordination, we received 57 LOIs totaling a little more of $200 million, which was about 10% of the request. And as you may be aware, that the RCO contract that the state will have with RCOs already has a very robust care coordination component, and it's one of the integral components of the RCO process and where we're headed with RCOs. So for the state to consider in that case a care coordination project, it would have to be above and beyond. And we'll get into a few more of the specifics on that to give you guidance. But again, that hasn't been verbally approved by CMS, so we want to be cautious at this point, and we'll be pushing that out as soon as we get approval from CMS on that. So if you go to the next slide, the intent and the purpose of what we're trying to accomplish with the implementation of projects is to produce sustainable clinical improvement in RCO program objective areas. So you can see that as we refined that just a bit, that some of the areas that were listed in that top 10 that we'll be giving you further guidance on in that arena. One of the things that we're certain about is that there will not be funding for duplicative projects in an RCO region. So just as we've encouraged before, we encourage providers to actually work together. That will be facilitated in large part. You may not know who had submitted a similar project to yours at this particular time. That will largely fall to the RCOs to collaborate with their provider group to talk about, submissions that they have received that are similar and trying to get those into one project. Again, there has been a change based on various scenarios that we can go into a little more deeply in the future, but we do ask that RCOs, that providers only submit to one RCO the project, and I think the fact that we're going to be able to delay some, it will give us an opportunity to revisit how we will communicate so that it would be to the benefit not only of providers but RCOs, and how that process works so that all the projects will be able to get a valid opportunity to be seen by the state. One of the key things too, within a region, we do want to make sure that all the beneficiaries benefit within a region from these projects and work plans and interventions. So one of the key components of the scoring process is impact on beneficiaries. So although the state is asking that a plan be submitted through one sponsoring RCO, we encourage providers to actually contract with multiple RCOs within a region so that all beneficiaries could be impacted in a positive way, and that will also enable you to get a higher score on that particular project, so that the intent is that we impact as many providers as possible. I'd like to turn it over now to my colleague, Christina Kostner, and let her take you into some of the guidance that we had talked about just briefly.
Thank you, Tommy, and good afternoon, everyone. My name is Christina Kostner, and I'm part of the Navigant team, assisting Alabama with the IPS program. So as Tommy mentioned, given the volume of funding requests that were reflected in the IPS letters of intent, AMA developed additional clarification regarding the IPS funding parameters so that the RCOs and providers are aware of the limits of the IPS funding, and particularly the IPS projects that AMA does not intend to approve. These clarifications are reflected in what we are calling an IPS Guidance document, and this document is currently under review by CMS, but will be posted to the AMA IPS webpage once CMS completes its review. Because this document still is under review by CMS, all of these points should be considered draft and are subject to change, but they do reflect the agency's current stance on the IPS funding opportunity. So there were a number of project categories that AMA wanted to bring to the RCOs and providers' attention as potential areas of concern. And as you can see on this slide, there are three main categories of concern, which are in the three columns on the left. First, projects that propose services and activities that are duplicative with services or activities that are already provided by AMA or will be provided by the RCOs. The second, projects that were not tied to clinical improvement. And third, projects that did not meet IPS objectives. I'm going to walk through each of the items listed on this slide, but again, once we receive feedback from CMS, you'll be able to read much more about each of these items in the IPS document that will be posted on the IPS webpage. So first, starting with the category of projects that were potentially duplicative with RCO or AMA services. As Tommy mentioned previously, the first row here, care coordination. Care coordination is one of the central components of the RCO program, and as such, the RCOs have extensive care coordination responsibilities. While some of the IPS letters of intent proposed projects that go significantly above and beyond the RCO care coordination requirements, others did not, and rather proposed activities that were very similar to what the RCOs will be expected to do as part of the RCO program. AMA will not approve projects that are duplicative with RCO responsibilities to avoid paying to avoid providing different payments for the same set of services. In addition, moving to the second row, a number of projects propose to pay for services that are currently Medicaid covered services. And again, this is considered duplicative and will not be funded through the IPS program. RCOs also have responsibilities for developing call centers and providing non-emergency transportation services. And the capitation payments that will be going to RCOs are reflective of these activities. And AMA will not approve these types of projects that propose to do similar activities as to what the RCOs are being paid to do through their capitation payments from AMA. Moving down to the line for electronic health records and health information exchange, AMA will not approve IPS projects that propose to develop their own health information exchanges. Alabama encourages providers to connect to the state's central health information exchange, called Alabama One Health Record. IPS applicants may use IPS funding to connect to the Alabama One Health Record as part of their overall IPS project. However, AMA is not interested in paying IPS funds for providers to develop different health information exchanges from the Alabama One Health Record. Related to electronic health records, there are other federal funding opportunities available to providers to implement electronic health records, and AMA will not approve IPS funding for the purchase and implementation of electronic health records. Moving to the second category on this list, projects that must be tied to clinical improvements, there were a number of projects that were described as simply purchasing software or purchasing medical equipment or providing beneficiary incentives without a lot of other surrounding project activities. While each of these items may be considered as part of a larger IPS project, these items must be accompanied by a comprehensive clinical improvement project that goes beyond what is required of RCOs and any provider's current activities, and that is also able to demonstrate that it is sustainable. In addition, the AMA will not approve IPS funding to pay for medical supplies or other medical or ancillary services that are not currently covered by the Medicaid program. It's possible that an RCO may choose to provide non-Medicaid covered services or supplies under its capitation rates. However, the IPS funds are not intended to enhance Medicaid covered services that are not otherwise available to all Medicaid beneficiaries. Similarly, AMA will not approve IPS projects that use funds to cover salaries for providers who will provide billable Medicaid services. There are a number of projects that propose to provide these types of salaries. However, AMA does not consider these types of projects to be sustainable over the long term, and therefore the projects do not meet the IPS objectives. And then finally, the last row of this slide, there are a number of projects submitted to provide services in schools or near schools. AMA is currently seeking additional clarification from CMS on these types of school-based projects. However, CMS has indicated in the past that they have concerns about using waiver funding related to these types of school-based services. So this is currently an area of concern for the agency. However, stay tuned for the final guidance document for further clarification. Just a few other quick points related to guidance from the IPS letters of intent. There were a number of projects that were focused on construction or renovation, which you saw on a previous slide. That was the top category of IPS funding. And while IPS funding may be awarded for these types of projects, the focus of the IPS program is really on clinical improvements. And so that's something to consider when developing IPS applications and considering the total amount of IPS funding available. There were a number of projects that were centered around initiatives that would impact a relatively small number of Medicaid beneficiaries, or services that currently have a relatively small component of the overall cost for Medicaid. So again, because the agency has a limited amount of IPS funding available, it wants to make sure that IPS funding goes to those projects that can impact a large number of beneficiaries and impact the total cost of care, or both. So that's another important consideration as you're working to further consider IPS projects. There are a number of projects that propose different telehealth initiatives, and when submitting projects, IPS applications for telehealth, it will be important to consider how these projects can be structured so as not to duplicate technology or have repetitive functionality, and that can also be sustainable. So that will be something to be sure to demonstrate within the IPS application. And then previously, there's been a number of questions about the types of other providers that may be included in an IPS project. When we're talking about other providers in this context, we're really talking about providers that will be contracted with an RCO and will receive payment from an RCO for implementing an IPS project that's approved by the agency. While an IPS project may include a wide variety of roles as part of implementing the project, in order to qualify as a participating provider, which again is a provider who will receive some of the IPS award money, the provider must be a Medicaid certified provider. It must be a contracted RCO provider at the time an IPS award is made, and the provider must be able to show a likely potential to have a significant impact on reducing the average total cost of care for a significant number of Medicaid beneficiaries, and have a direct ability to improve a region's overall performance on some of the target measures that are required by the demonstration waiver. When reviewing the IPS LOIs, some of the other providers that were listed are not able to be Medicaid certified providers according to Medicaid's policies, and therefore would not be eligible to receive part of the IPS awards directly. So I know that was a lot of information. Again, the document that lays this all out in writing is under review by CMS and will be made available as soon as CMS completes their review. So I wanted to move on to a brief description of the RCM Provider Roles in the IPS application process. We wanted to emphasize here that the development of the IPS application is really a shared responsibility between the sponsoring RCO and the participating providers. If you've had a chance to look at the IPS application so far, you'll notice that much of the information will require a lot of collaboration in order to develop strong responses to each of the IPS application components. So in terms of the participating provider responsibilities, as mentioned previously, each provider should select only one sponsoring RCO that will actually implement the proposed project within a particular region. And the provider should develop and submit the IPS application to the sponsoring RCO based on the RCO's deadlines and requirements. So each RCO will be responsible for communicating to providers what exactly the provider should be submitting to the RCO in regards to developing the IPS application and by what date. As Dr. Moon mentioned before, this timing is still a bit uncertain because of the program delay, but the agency will be providing more information on that as soon as it knows more. In terms of the RCO responsibilities, again, they're responsible for working with the providers to develop the applications and submitting the applications to AMA for review and scoring. The agency will also be asking the RCO to prioritize the applications that it submits to the agency in terms of the maximum funding amounts that are available in each region. So the RCO will be doing some prioritization as well before the applications are submitted to the agency. Moving on to some of the funding and payment requirements, we wanted to provide an example of some of the funding and payment processes, as there have been a number of questions from stakeholders regarding the funding and payment requirements associated with the IPS awards. Today, we wanted to highlight two of the requirements that have received the most questions. And these requirements are also stated and come from the special terms and conditions from CMS. The first requirement is that each IPS award will cover no more than 90% of the approved IPS budget, up to a maximum of $20 million. So what this means is that the providers, the RCO, or both will have to cover the remainder of the budget to implement the IPS project. So in the example on this slide, in the upper left-hand box, this is an example of an IPS project that has costs of $10 billion. In accordance with the STCs, the maximum award from the agency would be 90% of the $10 million, or $9 million. This leaves $1 million of the budget to be covered by the providers, the RCO, or both. RCOs and providers will be required to attest that the RCO and/or the participating providers will have sufficient funds or resources available to enable them to fund, at minimum, 10% of the IPS work plan or project budget as part of the IPS application submission. The second requirement, which is illustrated on this slide, related to IPS payments, relates to the distribution of the IPS award. In this example, AMA would issue the $9 million award to the RCO, which is indicated in the first box. And then that $9 million would be paid from the agency to the RCO. The RCO may retain no more than 10% of that total award for the purpose of administering and monitoring the IPS project. This means that out of the overall award, the RCO would be permitted to retain up to $900,000, although the RCO could retain less. The RCO would then distribute the remaining $8.1 million to providers in accordance with the distribution that is laid out in the IPS application. The award payments will occur on a quarterly basis, so not all of that award would be so that total award would be distributed across multiple quarters, not all at once. We will be adding some more detail to the IPS frequently asked questions document related to these types of questions within the coming week or so. Okay, so as was mentioned at the beginning of the webinar, one of the documents that was posted to the IPS webpage is an IPS Protocol Document. And this document was required by CMS, by the special terms and conditions, and lays out more information about the IPS program overall and how it will be operated. In addition to details about the IPS application components and the monitoring process for the IPS program, there's also a number of exhibits as part of the protocols, which you can see listed here on this slide. The IPS application, which my colleague Dustin will be walking through in just a bit, is Exhibit B1 to the IPS Protocol Document. Again, the document posted on the website is draft. CMS has not yet provided final approval, but this can be a great resource to you to understand more about all of the components of the IPS program and what will be required as part of the program. So we encourage you to review that document closely. And at this time, I'm going to hand the presentation over to my colleague Dustin Schmidt.
Thanks, Christina. And good afternoon to everyone on the phone call. I think what we're going to do next is we're going to pull up the IPS application in Excel. What I want to do first is just speak to, while we pulled this up, is just speak to the first slide there, which was just there's 4 elements that the agency will look at in reviewing the IPS application that would trigger the agency to not review the application. The first is just to ensure that the webinars that have been posted, that both the RCOs and participating providers have reviewed those materials. And that's provided through an attestation in the IPS application as well as in the participating provider's letter of commitment. Second element is the IPS application has to be submitted by the established deadline, which we have here is July 1st, which is likely to change based on the program delay, which Dr. Min discussed. Third element is that the participating providers and RCOs submitted the IPS application using the correct template, and then also address all the required application elements included. For example, the budget worksheet was completed. Then the fourth element is all participating providers that will participate in the specific IPS project. They have all submitted a provider's letter of commitment, which I'll talk in a little bit more detail later on. So what I'm going to do is just walk through, and I'll try to keep this at a high level because I know we have a lot to cover, and then we still have a few remaining slides to go over. In the first worksheet we have here is just a general instructions. So you notice here, the very beginning is really for the RCOs, and this is just for them, instructions for how they'll submit the IPS application to the agency, and then also the naming convention in which they'll upload that specific IPS project. The participating providers, we have the naming convention, so you should consider using that when you submit this to the RCOs, because then they'll eventually use that and then post it to the agency's website for review. One of the things we have embedded in the instructions is the participating provider's letter of commitment, and then this is also provided as Exhibit B2 within the protocol. So I'll just open this up quickly. And as I stated before, this is an attestation that each of the participating providers must complete and submit along with IPS application. And we're defining a participating provider as any provider that will receive payments directly from the RCOs. Some other items to note on the instructions worksheet is there's some other reference materials which will be helpful in completing the IPS application. One of them is the IPS protocols, which Christina described, the IPS guidance summary, which will be posted either this week or next week, which is really just dependent on CMS's feedback, and then also CMS's SCC requirements. The other item we have here is the 2015 State of Alabama Community Health Improvement Plan. And this just describes how Alabama can improve access to care, nutrition, physical health, activity, and mental health. And this will be used in answering question 3.3 of the IPS application. So I'll just quickly go through each section here, and you'll notice that the items highlighted, or the cells highlighted in green, are for the applicant to complete. And you'll notice also that when you enter in information that the color changes, so that is an indication that you all have completed that specific row. So just in general, this section here is just a very high level listing of the primary RCO contact name, the primary participating provider contact name, and also a high level IPS project name, and then the IPS project duration. And some of this information may be similar to how the LOIs were set up that you all submitted. Section 2 is just to provide a high-level overview of the IPS project, as well as identifying how your specific IPS project impacts the different target improvement areas, as well as the DSHP target measures. So similar to the LOI that you all had submitted. Other thing to know is that within here, you'll include, similar to the LOI, the provider types. So you have the different provider types as well as the other provider types, and then similar as before, if there are other provider types that will be impacted by the IPS project, to include a write-up of those providers here. And then at the bottom of this, we have the 3-year and then 5-year goal statement of the IPS project, which is a specific requirement from the STCs. Section 3 is beneficiary impact. So the first section here is just identifying the Medicaid beneficiaries that will be impacted by your project, and then scrolling down. And one of the things to note here as well is for some of the different questions, so like 3.3, what we tried to do is include examples for you all to use. And we did that in some of the other specific questions as well. One thing to note about this worksheet as well is for section 3.5, this will include the Medicaid beneficiaries that are impacted by the IPS project, and this may include Medicaid eligible beneficiaries from the sponsoring RCO, as well as other RCOs within the region if the participating providers have a contract with those other RCOs at the time of IPS funding. Moving on to worksheet 4, which is a work plan. So 4.1 is just, we're using this as a work plan to identify what your achievement goals of the IPS project are, as well as what your spending plan would be for the IPS project. And you'll notice that we have included some examples here for you all to use. Section 5 is related to monitoring. So this is just a couple of questions here about how the IPS project will be monitored throughout the duration of the project period. Section 6 is a listing of all participating providers, and what we would like to see here is for all the participating providers that are identified within this worksheet, each of those participating providers should also have submitted a participating provider's letter of commitment. Moving on to section 7, which is the budget. You'll notice that we included various expense categories, but we've also allowed for you all to include some additional rows within the budget calculation. And if you need to do so, please include, so you would add additional rows here, and then also put in a description up above of what that specific expense is. Another thing to note on here is, so all the cells highlighted in green are what we would expect, are opportunities for you all to fill in if these specific expense items relate to your IPS project. And you notice that there's various calculations throughout in this worksheet which are not highlighted in green. But once you enter in the expense numbers here, which I can just do an example, these numbers auto-populate out. One other thing to note from this worksheet is on the bottom here, section 7.5. So this is a detailed breakout of some of the expense items that we had included up above. So you'll see equipment and software. And if you scroll up above, you'll see equipment and software identified here. So this is just the total, but we would expect to see a detailed breakout of what those specific costs are. And we would expect also to see those numbers tie out. And then we have some other specific capital expenditure items that should tie to the budget on question 7.1. ROI and sustainability. So this is really two different sections combined into one. This is return on investment, which the important point here is the return on investment is based on the post full implementation. So after the IPS project has been implemented. And then below here we have sustainability, which is also based on post full implementation. Section 9 is related to the RCO quality measures. So 9.1 is for you all to identify which of, if any, of the 42 RCO quality measures will be used to evaluate your IPS project. And then below, we have if you will be using other performance metrics for you to enter those here. Section 10, so this is an optional worksheet, and this is just related to those IPS projects that impact the low-income uninsured patients. And low income is defined as individuals with incomes at or below 138%. So we'd expect to see from this worksheet is a description of the population as well as the estimated number of patients impacted. And this is a 25 points, and this is an optional worksheet and only to be completed if your proposed project impacts that specific population. Section 11 is a listing of other federal grants or funding that is received by RCOs or participating providers that may be duplicative of the IPS project. So we would expect to see participating providers to complete this as well as the RCOs. And then section 10, the last section here, is just related to attestations that the RCOs are expected to provide. So table 6 in the IPS protocols includes the application scoring components. There will be a total of 200 points. You notice like a majority of the points are going towards section 3, which is beneficiary impact, as well as section 8, which is return on investment and sustainability. You'll notice here that there's certain worksheet or application components that have NA, we'll be reviewing those for completeness, although they do not have specific points assigned to them. And then also included within the protocols is scoring considerations, and we've included a few of examples here in this slide. So you'll see like section 2, what we'll be looking at is in scoring based on the rationale or business case. Section 3, we'll be looking at the impact of beneficiaries to determine the magnitude of projects. Section 3 is we're looking at the number of beneficiaries impacted and the volume that they'll be impacted for that specific region. And then section 7 and 8, we'll be looking at reasonableness of the budget and ROI and sustainability and the sustainability plan. And then section 9, quality measures, we'll be looking at to see if the measures selected are appropriate and if any other additional performance measures are selected, if those make sense for the stated goals that were provided. Next section is, we just want to talk at a high level about the provider's appeals process and then the reconsideration process for RCOs. This is described in more detail in Exhibit 6 of the IPS protocols. I'll go through these dates, but the thing to keep in mind is that these will likely change based on the delay that Dr. Moon talked about at the beginning of this presentation. So how we have it set up now is from now until July 8th, if an RCO denies an IPS application, the participating providers may appeal through a written request to the Medicaid Quality Assurance Committee. The Medicaid Quality Assurance Committee will review and forward all project it thinks that AMA should consider. And the RCO's decision shall be entitled to a presumption of correctness, and the QAC shall only reverse the RCO's decision if either of the two terms occurs. First being the decision was made on unreasonable grounds or without proper consideration. The second being any applicable conflict of interest policy was violated during the RCO's decision-making process. Another thing to note here is that the QAC's decision is final, is not subject to further review. And then if the QAC forwards an IPS application if the QAC forwards the IPS application to the agency will include this in its normal scoring and review process. Other thing to note on this worksheet is the RCOs also have a process for submitting IPS applications back to the agency for reconsideration after the agency has decided that it did not want to move forward with their specific IPS applications. Another thing to note here is that the agency decisions on reconsiderations are final. Next steps. So it's important for you all to review the IPS protocols and any other information that we have on the AMA IPS webpage. And look for the IPS Guidance document that the agency will provide either this week or next week, which will provide a lot more detail of the information that Christina had walked through. The second is RCOs should communicate with providers regarding which sections of the IPS application they must complete and the timing surrounding when those specific sections are due. I think a lot of this will depend on the guidance that Alabama Medicaid provides in regards to the delay and what the delay will have on the IPS program. And then the other thing to note here is the agency's in the process of developing a work plan status report, which will be used and provided by those IPS projects that are approved by the agency. And those are used for us to evaluate and to see how the IPS project is moving forward and if it's meeting its established deadlines. And then it'll also be used for award payments. This slide here you should all be familiar with, but these are the RCO contacts by each of the RCOs by region. This was also included in the previous presentation that the agency had provided to you all regarding the LOI submissions. And this marks the end of our presentation. You can find additional information on the AMA IPS webpage. And it's a good idea to check this on a regular basis as we try to keep the FAQ listing updated every 1 to 2 weeks. And then you can submit IPS related questions to the RCO quality email address. And we look forward to speaking with you all again tomorrow during the same time where we will answer all of your IPS related questions.